Claire McCarthy and Doug Eastman, thanks for joining us on the eHealth space. Firstly, just introduce yourselves. Give us a very quick overview of who you are and what you're doing at Healthy Nation, this conference here today in Melbourne. Claire.
Sure. I've been working in healthcare my entire career and spent most of that time working on human change management issues, which has kept me very busy indeed all that time. A lot of what I do is focus on technology implementation. So again, working on the people-related challenges associated with installing and implementing, and then eventually, hopefully, proficiently using those technology tools to drive changes and improvements in healthcare.
Okay.
And
you're at Kaiser Permanente now?
I'm currently at Kaiser, yes, but I've worked at multiple health systems across my career.
Yep.
And Kaiser is certainly the largest and with the most complex implementation I've ever worked on, which was the Health Connect deployment, which is Kaiser's electronic medical record system.
Okay, great. Doug, yourself?
Yeah, very much the same. I'm the executive director for technology adoption. And basically what that means is I focus on the people side of technology implementations. So I look at how we implement, how we optimize technology, and making sure that end users are embracing it.
Mm-hmm. Now, if you could summarize very briefly the American health system as it very big, I know, but obviously not just big, but extremely complex. Give us a very quick sense of just how it works, because I think for a lot of clinicians in Australia, we don't really appreciate the scale of challenges you face. Claire?
Well, it's enormous and it's complex, and there's a great deal of autonomy across the system. It's not a single system in any sense of the word. We certainly have a large government-funded portion of healthcare, but most people get their health insurance through their employer, which is something that's been in place in the U.S. for a long time. It is beginning to erode. Employers can no longer afford the generous health benefits that have been provided over the years, and so the general population is having to assume more financial responsibility for their health care. We're also very disjointed in the sense that we have multiple health systems, and many providers, many clinicians actually work in private practices. So they're not necessarily associated directly with a large healthcare system. So there's a great deal of variation, and it just makes it complicated. We're hoping that over time, once there are electronic medical record systems installed broadly, that the communication of patient data will be much more efficient and effective, and certainly then we would expect to see improvements in healthcare outcomes.
Well, let's build on that. Doug, how would you describe the momentum within the broader healthcare system in the States to embrace eHealth as the way forward? How far down the path of willingness to properly embrace it do you think it is?
I think we're pretty far down the path. The premise here is to try and reduce costs and increase efficiency so the patients get better service at a fair price. And so I think technology is enabling that, allowing us to provide better care, more timely information at our disposal, and I think we're far down the path.
Okay, so because there's obviously lots of hurdles that we face.
Certainly.
And one of those is stakeholders, and if we can start talking a bit about change management, obviously, which is your big focus. How do we go through the process of identifying these hurdles? Claire, there's plenty of pockets of resistance in eHealth that we're all familiar with. What are the tips that you would suggest for approaching those pockets of resistance?
Well, one of the things that Doug and I speak about frequently is the real value and necessity for having effective sponsorship for large change programs. And in the U.S., the way that's working now is the federal government is providing financial incentives to health systems to meet the new requirements. So we have three things in big buckets happening simultaneously: the conversion to ICD-10, the meaningful use regulations, which drive quality improvement measures, and then the drive toward accountable care organizations. Those things are being incentivized. So now that you put money on the table, people are paying more attention, and it's creating a financial reality that makes it possible for hospital systems and private practices to actually make these changes and put them in place.
Okay.
So that's the first thing. We've got sponsorship.
That sounds like a carrot.
Absolutely.
Yeah.
It absolutely is. We've got sponsorship, so we've got someone painting the direction. The legislation, defines the details, shows people what the path is, and then the government providing the incentive to do that is really creating a reinforcement system.
Okay.
So those are two things: sponsorship, reinforcement.
Okay. And how well do you think the medical community has engaged with that from a systems design perspective?
Well, I think certainly if you talk to physicians, which we do, there are many of them that really are behind the healthcare quality improvements that are stipulated in the meaningful use regulations.
Yep.
There's a lot of controversy in the U.S. about whether or not every patient ought to be obligated to purchase health insurance, but that's a separate issue in my mind from the vast amount of quality improvements that the legislation is designed to drive. The issue of individual purchasing of health insurance is, in my mind, is fundamentally about the fact that if we don't have everyone in the risk pool, we really won't be able to drive the costs out.
Okay.
So how that's going to be done, ultimately, I don't know. But certainly the debate is raging.
Yeah. Let's talk about the study. You've been doing started a study here in Australia on understanding our eHealth system. Doug, what's the approach you're taking there?
Well, we're trying to interview CEOs and CIOs from healthcare organizations across Australia to understand how they've addressed human challenges in implementing technology. And we're finding some rather interesting data, consistent trends that we're seeing across the U.S. and other countries. But what's really interesting about it is just the passion around making sure that the information is there, we can deliver quality services to the patients.
Any sort of early insights from those interviews?
Yeah, I think the biggest part right now is leadership. So Claire mentioned sponsorship, but leadership and being able to paint the picture of what the future could look like. And I think it's a lot easier for individuals to get on board and embrace that vision when they feel like they're contributing to something larger.
Yeah, it's actually a very common Australian cultural trait, which is who's running the show.
Yeah.
We have this question like, well, we're not going to do anything unless we know who's in charge.
Right.
But there's also a sense that I get that this needs to be a shared responsibility. So how do we kind of move away from the command and control kind of ethos to perhaps a broader sense of desire in the community to want to affect this change?
Well, I think just being here at the Healthy Nation conference is a good sign of people coming together, talking, understanding everybody's needs and visions for the future. It's really important to understand your stakeholders.
Yeah.
And in Australia, there's a whole bunch of stakeholders, just like there are in any other country or organization.
Yeah.
So this is a real opportunity to bring people together and do it right.
Let's just talk pragmatically for a second. What are some common mistakes when it comes to change management that healthcare organisations typically make? Claire, we should ask you.
Well, to get back on the sponsorship bandwagon, not having clear, effective sponsorship. In other words, who is in charge? Who's the one who's actually accountable for the outcomes? Who is dedicating the resources to ensure that the project can move forward?
Yeah.
Many organizations don't do that well yet. I think it's an evolving competency, but it needs certainly further discussion and definition so that people understand the breadth of what's required of an effective sponsor. And it's not just showing up once in a while. It's much more than that.
Yeah. So is there actually a mindset here where we have to say, this is not just about a new program of work. This is actually a cultural change, quite a much significant change that perhaps we don't anticipate? Is there a mindset issue here?
I think there is. I think it's a transformational change. It certainly changes the way clinicians practice. When you move away from paper and you're looking at data electronically, when you can get it from virtually anywhere, when the patient has access to the data as well, it changes the way things operate. Patient expectations are changing as a result of all of that. And to get back to one of your earlier questions, we like to say that the what and the why come down. That's a sponsorship responsibility. But the how it's all going to work, how it will unfold over time comes up. And that's the participation aspect. That's where you get the stakeholder engagement, is through getting them involved.
I recognise that it's a very difficult area to try and get some very clear sets of advice. But how, Doug, can we make sure that the people trust the system? You know, from a clinician's perspective, getting them on board. Trust is key, it seems to me, in all of this. How do we make sure that they trust it implicitly?
Sure. I think there are several things you can do to increase trust. Number one, we don't want people to feel like the technology is being jammed down their throats. We want to give them an opportunity to chime in, provide feedback, get their questions answered, process the information. I also think it's important that if you do paint a vision or some picture of the future, that you're able to eloquently speak to the value proposition for each of those stakeholder groups, how it's going to make their lives better. And ultimately, it's what's in it for them. How is it going to change their work life? How is it going to increase patient safety? So building that connection to the overall vision is really important. I also think building trust is very highly linked to making sure the data is accurate. If clinicians can rely on the data and it's actually helping them perform better, then I think the trust level increases.
Okay.
But if they can't rely on it, you know, they're going to take a step back.
Claire, did you have anything you would like to add to
Oh,
that?
just that I always like to point out, look at the way things are on paper.
Yeah.
It is not reliable, it's not searchable. You go in the chart and the very thing you need may be the one thing that's missing. And so I think we make a mistake if we overvalue perfection in technology. I think these things will improve and evolve over time. Certainly Doug's points about accuracy and data are important because clinicians need to rely on the data in order to make informed decisions. But it's not all going to be perfect as we get started. We have to start somewhere. And clearly the paper record is something that's just not sustainable long term.
Tell me your thoughts on a broader industry perspective. We have hundreds of vendors that want a slice of the action here. Change management also affects them. What advice do you have for software vendors and integrators and all these companies that ultimately they can't all win? And so there's a broad industry change going on. And what are your thoughts on how they should approach that?
Well, I think that those software vendors who focus on the human element as part of their offering stand the opportunity to be more successful. The reason is that the software in and of itself, even when it's installed well and is functional, it doesn't change anything until people change their behavior. So there's really a question about what's the definition of the ultimate success? What are we trying to accomplish? Is it functional software implementations or is it human beings changing behavior to drive value?
Yes. What comes first, the technology or the people?
Well, the technology, I think, it's very interesting because I see the technology as clearly an innovator, and the technology creates opportunity that's not there without it.
Yeah.
So if we aren't installing technology, we wouldn't be having this conversation.
That's right.
However, installed functional technology, in my mind, is just the beginning. After the technology is working, that's when we really figure out what's happening and what's it going to take to make things successful.
I think the point is, no matter how shiny and new the gadget's going to be, it's just a gadget. It needs to be used. And so when you ask about the different providers of technology, I think it's the folks that are able to understand it's not just a one-off scenario. It's the ability to integrate. It's got to be scalable. It's got to be usable. And what we're finding is with technology, if it's easy to use, it's embraced quicker.
Right. Absolutely. Clinicians are busy. They don't have time to say, I wonder what would happen if I tried this, or to have many, many clicks to get through to something. So to the extent that the software can be efficient, easy to use, designed from a clinician's perspective, it just simply makes the adoption process easier.
Well, I know this path has a long way to run, so I wish you all the best with your research in this country and also this afternoon with the panel here at Healthy Nation. So Doug Eastman and Claire McCarthy, thanks for your time today.
Thank you.